Good day for everyone who's here to listen and want to know more about HIV and AIDS. So first let's talk about what HIV and AIDS are. So, HIV is a sexually transmitted infection, STI. It can also be spread by contact with infected blood and from illicit injection drug use or sharing needles. It can also be spread from mother to child during pregnancy, childbirth or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. An acquired immunodeficiency syndrome, or AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. What is the difference between AIDS and HIV? AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. In the US, most people with HIV do not develop AIDS because taking HIV medicine as prescribed stops the progression of the disease. Symptoms. The symptoms of HIV and AIDS vary, depending on the phase of infection. Primary infection, acute HIV. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary, acute, HIV infection, may last for a few weeks. Possible signs and symptoms include fever, headache, muscle aches, and joint pain, rash, sore throat and painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, night sweats. These symptoms can be so mild that you might not even notice them. However, the amount of virus in your bloodstream, viral load, is quite high at this time. As a result, the infection spreads more easily during primary infection than during the next stage. Currently there's no cure for HIV/AIDS, but medications can control the infection and prevent progression of the disease. Antiviral treatments for HIV have reduced AIDS deaths around the world, and international organizations are working to increase the availability of prevention measures and treatment in resource-poor countries. There's no vaccine to prevent HIV infection and no cure for HIV/AIDS. But you can protect yourself and others from infection. To help prevent the spread of HIV, consider pre-exposure prophylaxis, PrEP. The combination oral drugs emtricitabine plus tenofovir disoproxil fumarate, Truvada, and emtricitabine plus tenofovir alafenamide fumarate, Descovy, can reduce the risk of sexually transmitted HIV infection in people at very high risk. Use treatment as prevention, TASP. If you're living with HIV, taking HIV medication can keep your partner from becoming infected with the virus. Use post-exposure prophylaxis, PP, if you've been exposed to HIV. If you think you've been exposed through sex, needles or in the workplace, contact your health care provider or go to the emergency department. Use a new condom every time you have sex. Use a new condom every time you have anal or vaginal sex. Women can use a female condom. Created by Charles Bruce Basnillo, Jigs Alipin, John Hendrick Gepitulan, Heryol Abellana and Cutie Adrian Fernandez. Thank you for watching.